Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Colon cancer. Introduction. Colon cancer is one of the most common cancers among men and women. Colon cancer can be a life-threatening condition that affects the large intestine. However, if it is found early, it is a highly curable form of cancer. This program will help you better understand what colon cancer is and what treatment options are available. Anatomy. The colon makes up the last 5 feet of the intestines. Swallowed food first goes through the esophagus, which is the tube that takes the food to the stomach. Next, food passes through the stomach, where it is digested. Digested food goes from the stomach to the small intestines, where nutrients are further digested and partially absorbed. Fibers and digested food finally reach the colon. In the colon, water and nutrients are removed from the food, and what is left is turned into waste, known as stool. Stool is then stored in the last part of the colon, the sigmoid and the rectum, before leaving the body. Arteries provide blood to the colon, and veins take the blood back toward the heart. Lymphatic tissue and lymph nodes drain excess fluid into the bloodstream. Lymph nodes help fight colon infections and cancer before they spread to the rest of the body. The colon has several components: the ascending colon, the transverse colon, the descending colon, the sigmoid colon, the rectum, and the anus. Cancer and its causes. The body is made up of very small cells. Normal cells in the body grow and die in a controlled way. Sometimes cells keep dividing and growing in an uncontrolled way, causing an abnormal growth called a tumor. If the tumor does not invade nearby tissues and body parts, it is called a benign tumor or non-cancerous growth. Benign tumors are almost never life-threatening. Cancer, such as colon cancer, usually starts as an overgrowth of normal cells called a polyp. Cells in polyps may continue to grow even more out of control. If left unchecked, they can become cancerous. The earlier polyps are discovered and taken out, the better your chance of avoiding or curing cancer. If a tumor does invade and destroy nearby cells, it is called a malignant tumor or cancer. Cancer can be life-threatening. Cancerous cells may spread to different parts of the body through blood vessels and lymph channels. Lymph is a clear fluid produced by the body that drains waste from cells. It travels through special vessels and bean-shaped structures called lymph nodes. Cancer treatments are used to kill or control abnormally growing cancerous cells. Cancers in the body are given names depending on where the cancer started. Cancer that begins in the colon will always be called colon cancer, even if it spreads to other places. Although healthcare providers can locate where a cancer started, the cause of cancer cannot usually be identified. Colon cancer tends to run in families, so people with close relatives that have colon cancer should be examined regularly for any sign of it. Some genetic abnormalities increase the risk of colon cancer. Some of these abnormalities, along with an increase in colon cancer risk, can also increase the risk of prostate cancer in men. Cells contain hereditary or genetic material called chromosomes. This genetic material controls the growth of the cell. Cancer always develops from changes that occur in the chromosomes. When the genetic material in a cell becomes abnormal, it can lose the ability to control its growth. Sudden changes in the genetic material can happen for a variety of reasons. This tendency may be inherited. Changes in the genetic material may also happen from exposure to infections, drugs, tobacco, or chemicals, and from other factors. Continuous inflammation of the colon, known as colitis, can increase a person's chance of developing colon cancer. People with colitis should have regular examinations by their healthcare provider in case any signs of colon cancer begin to appear. A high-fiber and low-fat diet may lower a person's chance of developing colon cancer. Some studies suggest that people who take aspirin regularly are less likely to have colon cancer. Ask your healthcare provider what prevention methods are right for you. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Symptoms and causes. The best way to treat colon cancer is by finding it very early, even before it causes any symptoms. Since colon cancer can be treated best when it is found early, yearly physical exams are very important. Common symptoms of colon cancer are a change in bowel habits, such as diarrhea or constipation, feeling that your bowel does not empty completely, finding blood, either bright red or very dark, in your stool, finding your stool is narrower than usual. Other common symptoms of colon cancer include frequently having gas pains or cramps or feeling full or bloated, losing weight with no known reason, feeling very tired all the time, having nausea or vomiting. Most often, these symptoms are not due to cancer, but anyone with these symptoms should see a healthcare provider to have them checked out and be treated as early as possible if needed. How extensive a colon exam must be depends on your age, your family history, your previous medical history. In patients with diseases of the colon or with family members who have similar problems, colon exams should be done more often. If not discovered during a routine exam or testing, colon cancer can show up in various ways. The blood vessels of cancer are usually more fragile and tend to bleed easier than normal blood vessels. Therefore, colon cancer can lead to internal bleeding in the colon. The blood then mixes with the stool. Depending on how far the cancer is from the rectum, blood in the stool can either be bright red or can discolor the stool, giving it a dark maroon or coal black color. Blood in the stool does not always mean a patient has colon cancer. Other conditions, such as ulcers, hemorrhoids, and inflammation, can also cause bleeding in the colon or intestines. Bowel habit changes, such as diarrhea or constipation, can also be caused by other conditions. If colon cancer becomes very big, it can cause a bowel obstruction. The patient will have severe pain in the abdomen area with nausea, sometimes vomiting, and the inability to pass gas or stool. This can be a surgical and medical emergency. Diagnosis. Colon cancer is suspected if a stool exam shows blood in the stool. A routine and simple test can detect blood in the stool. If blood in the stool goes unnoticed for some time, the patient may lose a fair amount of blood. This is called anemia. The signs of anemia include dizziness, lightheadedness, and a feeling of being tired all the time. Routine digital rectal examinations can detect a growing lesion in the anal or rectal areas. A healthcare provider may also be able to find a polyp or a cancerous lesion during a scope exam of the colon. There are two types of scope exams that are commonly performed. One type is called a sigmoidoscopy. The healthcare provider inserts a flexible scope into the rectum and sigmoid, the lowest part of the colon. Once the scope is inserted, the healthcare provider is able to look inside for abnormalities. The other type of scope exam is called a colonoscopy. For this procedure, the healthcare provider inserts a longer, more flexible scope that goes in through the rectum and reaches the first part of the colon, called the ascending colon. This test is more thorough than a sigmoidoscopy. It is usually possible to remove a small piece of abnormal tissue or polyps found during a scope exam. This is known as a biopsy. The small piece of tissue is then given to a pathologist, a specialist who is trained to find cancer in tissue by looking at it under a microscope. If the abnormality appears to be cancer, then treatment is needed. Other tests may also be done to diagnose colon cancer. One such test is called a CAT scan. A CAT scan is short for Computed Axial Tomography Scan. During a CAT scan, the patient is placed in a donut-shaped machine with a big hole. As the body is moved through the hole, X-rays are taken to see the inside of the abdomen. A computed tomography colonoscopy uses CAT scan technology to screen for colon cancer. This is called a virtual colonoscopy. A barium enema is another test that helps diagnose colon cancer. For this test, chalky white liquid called barium is released into the colon using an enema. X-rays are then done to help see how far the cancer is spread. Discuss your options for colon cancer screening with your healthcare provider. Options for routine screening include colonoscopy every 10 years, flexible sigmoidoscopy every 5 to 10 years, fecal occult blood test every year, stool DNA test every 1 or 3 years, computed tomography colonography, also called virtual colonoscopy, every 5 years. An ingestible pill camera may be a screening option for patients who have trouble with colonoscopies due to other health issues. The pill camera is a device that you swallow. It takes images of the inside of your intestinal tract as the pill moves through your body. Your healthcare provider will review the images for polyps or other signs of health problems. The images taken by the pill camera may not be as clear as those taken during a colonoscopy. Biopsies are also not possible with a pill camera. Treatment options. Most patients with colon cancer have surgery to take out as much of the tumor as is safely possible. During the surgery, some of the lymph nodes in the abdomen are also taken out and checked for cancer. If the cancer has obviously spread to other organs in the abdomen, some of that cancer may also be taken out. Depending on where the cancer is in the colon, the surgeon may have to reroute the colon to the outside. This is called a colostomy. Sometimes a colostomy can be closed surgically months later. Depending on how fast the cancer is growing and whether it has spread to other organs, further treatment may or may not be necessary after surgery. If further treatment is necessary, then your oncologist may recommend radiation therapy or chemotherapy. Radiation therapy is often used in patients where the cancer has mostly affected the rectum. Sometimes it is given before surgery. Radiation therapy is a series of high-energy radiation treatments to the area that has cancer. It is usually given once a day during weekdays, and it usually takes a few weeks to complete. Chemotherapy is given either by mouth or into the bloodstream through intravenous lines. It treats the cancer using very strong chemicals. These chemicals can sometimes cause nausea, vomiting, and hair loss. Targeted therapy may be another option for advanced colon cancer. This treatment targets specific differences in cancer cells to try and prevent the cells from growing and spreading. Targeted therapy is usually given with chemotherapy. Talk with your healthcare provider to see if this is a good option in your case. Immunotherapy or biological therapy is another type of cancer treatment for advanced colon cancer. Immunotherapy fights cancer by boosting your body's immune system. It may help your body kill cancer cells, slow down their growth, or prevent them from spreading. Like any cancer treatment, immunotherapy can have risks and side effects. Immunotherapy may not be right for all cancer patients. Some types of immunotherapy are still being studied in clinical trials. Ask your healthcare provider if immunotherapy can help with your cancer. Patients with colon cancer have the best chance of surviving if the cancer is found very early and treated surgically. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Colon cancer is one of the most common cancers among men and women. Most patients with colon cancer have surgery to take out as much of the tumor as is safely possible. During the surgery, some of the lymph nodes in the abdomen are also taken out and checked for cancer. Radiation, chemotherapy, targeted therapy, or immunotherapy may also be used. The earlier colon cancer is found, the better the chance for survival is. Therefore, regular checkups are very important to help detect cancer early and remove it from the body. Discuss your options for colon cancer screening with your healthcare provider. Options for routine screening include colonoscopy every 10 years, flexible sigmoidoscopy every 5 to 10 years, fecal occult blood test every year, stool DNA test every 1 or 3 years, computed tomography colonography, also called virtual colonoscopy, every 5 years. Thank you for using Explain.